Thank you so much, Dr. Mehwish Rafiq. Assalamu alaikum. Myself Sabina Perveen, PG Scholar Department of Tahafuz wa Samajite, batch 23-24. And my topic is a standard treatment guideline on management of common musculoskeletal disorder in the Unani system of medicine under the supervision of Dr. MD Tanveer Alam, Associate Professor cum HOD Department of TST. This guideline has been initiated by the Ministry of Ayush, Government of India, conceptualized the idea of creating a standard treatment guideline on management of common musculoskeletal disorder in the Unani system of medicine. The project was developed under the Ayush vertical of the Directorate General of Health Services. The development of this guideline was made possible through support from CCRUM, subject expert and Unani physician from various national institutes. The project was conceptualized and led by Professor Dr. Atul Goyal, Director General DGHS, senior most medical advisor and overall leader of the DGHS structure, overseeing all IU's integration effort. Second, Dr. A. Raghu, Deputy Director General DGHS, Dr. N. Zahir Ahmad, Director General CCRUM. National Expert Committee for STG selected member Professor Dr. Atul Goyal, Vaidya Jayant Dev Pujari, Professor Abdul Wadud, Dr. Ghazala Javed, Professor MMS Siddiqui, Professor Muhammad Alimuddin Kamri, Dr. Ramavatar Sharma, Dr. Rupesh Vilas Patel. From CCRUM headquarters, Dr. Amanullah, Dr. Farah Ahmad, Dr. Usama Akram, Mr. Muhammad Niaz Ahmad. From Peripheral Institute, Dr. Rasidullah Khan, Dr. Ahmad Saeed, Dr. Kamruddin, Dr. Nikhat Perveen, Dr. Akhtar Pervez, Dr. Abdul Rashid, Dr. Afsahul Kalam. Now, purpose and need of this project was this. Purpose and need of this project. This initiative was taken to address the growing burden of musculoskeletal disorder in India, promote evidence-informed Unani practice, bridge classical Unani knowledge with modern clinical protocol, provide primary to tertiary level guideline in a structured, integrative, and accessible format, empower Ayush professional with a scientific stepwise protocol for each disease. Timeline and publication finalized and published in April 2024. Development process through multiple expert group meeting, extensive consultant and institutional collaboration. Published by Ayush Vertical Directorate General of Health Services, Ministry of Health and Family Welfare. The project covered following disorder like osteoarthritis, rheumatoid arthritis, cervical spondylosis, lumbar spondylosis, fibromyalgia, adhesive capsulitis, also called frozen shoulder. Now I'm going to shortly describe each disease one by one. First, osteoarthritis. According to modern perspective, it is degenerative joint disease. Characteristic feature: progressive cartilage breakdown occur. Mostly affect the knee, hip, finger, and lower spine. Prevalence rate is 80% of people with knee pain have some form of osteoarthritis. 20% report significant functional disability. According to Unani perspective, occur due to accumulation of abnormal phlegm, balgame ghair tabii in the joint, weak digestion, lack of physical activity, sedentary habit, cold and moist temperament of joint, and pathological sign tahazur mufasil, joint hardening or stiffness. Second, rheumatoid arthritis. In It is chronic systematic autoimmune disease that primarily affect the synovial joint, causing pain, swelling, stiffness, and gradual joint destruction. It mostly more common in women than men. Onset between 30 to 50 years, lead to disability if untreated. Caused by sway misas damvi har pathogenesis, accumulation of hot and moist morbid matter in the joint, and diagnostic criteria full and rapid pulse, disturbed sleep, and irritability. Third, cervical spondylosis. It is a degenerative disorder of the cervical spine due to age-related wear and tear of intervertebral disc and vertebra. It affects more than 85% of people over 60 years of age, more common in those with sedentary lifestyle, poor posture, and prolonged screen use, and caused by sway mijaj bari diabetes, accumulation of cold and dry matter in the cervical spine. Chronic cases may show nerve compression symptom like radiating pain and numbness. Lumbar spondylosis. It is degenerative disorder of the lower spine characterized by disc degeneration, bony overgrowth, osteophytes, and narrowing of the spinal canal. Common after age 40, and pathogenesis abnormal cold dry temperament lead to pain, stiffness, restricted movement. In severe cases, numbness, radiating leg pain, or sciatica like symptom occur. Diagnostic criteria nabze bati, slow pulse, and pale thick urine. Fibromyalgia, also called a generalized pain disorder. It is chronic non-inflammatory condition characterized by widespread musculoskeletal pain, fatigue, and cognitive dysfunction caused by sway mijaj barid temperament. It's affect 2 to 8% of the population in India, more common in women, onset typically between 30 to 50 years. Diagnostic criteria persistent body pain for at least 3 months, cold and soft skin, weak pulse. Adhesive capsulitis, which is frozen shoulder, characterized by stiffness, restricted shoulder movement, and progressive loss of function due to fibrotic thickening and adhesion in the shoulder joint capsule, caused by sway mijaj bari diabetes. Affects 2 to 5% of population, more common in women, typically age 40 to 60 years. And diagnostic pain and stiffness symptom worsen at night or with cold exposure, pain aggravated by movement and relief by warmth. Their core principle of management of musculoskeletal disorder in Unani system of medicine, and which is pain relief, evacuation of morbid matter, resolution of swelling, and joint strengthening drugs. Treatment modality is almost same for all types of musculoskeletal disorder. Like in इलाज with tadbir, we can do hijama for divert morbid humor. First, blood for bloodletting to eliminate morbid blood. Dalk for improve circulation and reduce stiffness. Takmide har to relieve cold induced pain. Natul for pouring warm decoction on joint. Tadheen moisture and moisturize and warm joint. Hammam detox and relaxation. Abzan for localized warmth therapy, warm therapy. And K expel phlegmatic toxins. Munjiz musil for mature and expel morbid phlegm. Here is list of single and compound formulation of osteoarthritis, like chopped chini, kolonji, and zanjabil, gingibil, and usag. These are single drugs, and dosage form are powder, and dosage 5 to almost 5 to 10 gram in twice two divided dose taken after meal. Duration given at 15 days to 1 month. Uh, and habbe asgandh, habbe suranjan, majun chop chini, majun suranjan. These are compound drugs. Majun taken in semi-solid preparation, doses from age 1 for Habbe Suranjan 1.1 to 3 gram in two divided dose taken after meal for 15 days to 1 month, and Majun Chop Chini and Majun Suranjan doses from 5 to 10 gram in two divided dose taken after meal for 15 days to 1 month with water. And these are रोगने बाबूना, सादा रोगने सुर्ख, रोगन ए जैतून, and दिमागे मुहल्लिल for local application. These are single drugs and compound formulation of rheumatoid arthritis. Compound formulation Majun Usba, Habbe Suranjan, dosage given 5 to 10 gram in Majune Usba in two divided dose after meal for 15 days to 1 month, and Habbe Suranjan in pills form dosage form is 500 to 1500 milligram in two divided dose taken after meal 15 days to 1 month. Uh, and compound formulation for local application Rogane Babuna, Rogane Gul, as directed by the physician, and Mufrad drugs Kolonji, Zard, Cho, Cho, uh, 5 to 10 gram in two divided dose after meal 15 days to 1 month. Single and compound drugs of cervical spondylosis like chop chini, kolonji, zanjabil, usak, habbe asgandh, and habbe suranjan. Majun chop chini, majun suranjan, rogane babuna sada, rogan sur, rogane zaitun, and dimag muhallil. These are drugs of lumbar spondylosis, and these are for fibromyalgia like habbe suranjan, habbe mukil, majun falasfa, rogane banafsha, rogane gul, आलू बुखारा, संदल सफेद, जरिस्क, बीही, बाखला, चुकंदर, and काहो. They are drugs of adhesive capsulitis, buzidana, suranjan, suranjan, shibr, gule tisu, and tukme shibd. माजून जोगराज गुगुल, माजून उस्बा, रोगने गुल, रोगने बाबूना, रोगने सुर, and रोगने ससुन. Diet and lifestyle recommendation: avoid flame producing food, sedentary lifestyle, and cold wet diet like dairy products, sugar and processed food, fried and oily food, red and processed meat, white flour products, cold food and beverage, banana especially at night, and alcohol. According to Zakaria Raji, fish and poultry are favorable for vajal mafasil patient, while contraindicated by other foods include bangles gram, Indian millets, big beans, French beans, palak, chukandar, carrot, badam, akhrot, khajur, apricot, angur, etc. And Unani special giza, maul shair, maul as halwa, magaz gekwar. Level of healthcare management. We have three level of healthcare management. Primary level secondary level, tertiary level. In primary level, facility given in PHC and solo clinic, and action undertaken are clinical diagnosis, basic treatment, diet and lifestyle. In secondary level, prevention. Its secondary level management, facility given in CHC and a small hospital, and action undertaken are at X-ray, TENS physiotherapy, OPD drugs. Level 3, facility given in Ayush Teaching Hospital, tertiary care, and action taken under this level is MRI, synovial fluid exam, advanced Unani and supportive care. Follow-up strategy, regular monitoring every 15 days, reinforce exercise, lifestyle, and patient education, reassess functional ability, response to treatment, and modify therapy if no improvement. Referral criteria, if no improvement in symptom, suspected comorbidity, example diabetes, mellitus, and hypertension, and progressive disability or deformity, complications like severe swelling and contracture. Now I'm going to discuss some research paper related to musculoskeletal disorder. We have added first paper is randomized comparative clinical study on osteoarthritis knee with Unani formulation and hijama bila shart. Author name NCN Razana and Muhammad Alimuddin Kamri. Journal name International Journal of Unani and Integrative Medicine. Affiliation in NIUM Bangalore Department of Malazar. In methodology, study design, open label, randomized, active control clinical trial, sample size 35 patient, BMI 30 to 39.9, age 30 to 60. Duration of the study March 2014 to January 2015. Study group, test group, n is equal to test group, patient taken 20, receive oral hub and local zimat, and control group 15 receive dry cupping therapy. Duration 15-day treatment with 5 follow-up. Assessment to subjective pain, morning stiffness, difficulty in movement, objective WOMAX index, pain, stiffness, and physical activity. Hub tablet ingredient is Suranjan, Bozidana, Hanzal, Garikun, Sipr, Mukil, and Turbol. And Zimad ointment ingredient is beeswax, limum usitatissimum, trigonal phoemum, matricaria, chamomilla oil. Oral treatment doses is 2 tablet, 800 milligram each, 3 times per day after meal with water, and topical application 10 gram per affected knee, 3 times per day. Control group hijama bila shar cupping, technique dry cupping on the knee joint for 15 minutes daily for 15 days. Results: subjective parameter, knee joint pain and difficulty in movement were found highly significant in either group, whereas morning stiffness was found insignificant in both groups. WOMAX index score combined score were found significant, stiffness was observed not significant. Conclusion: this comparative trial revealed that intervention of both groups are effective in ameliorating the symptom of osteoarthritis knee. Test drugs were found comparatively little more effective than control. Moreover, intervention of both groups were found to be effective without any adverse effect. Second paper, evaluation of efficacy of Unani formulation, Nuskae Munzis, along with weight cupping hijama bil shart in patient of rheumatoid arthritis, Wajal Mafasil, as an adjuvant therapy. Author name Soleha Khatun, Muhammad Soeb, Jamal Azmat, and Muhammad Anwar. Journal name International Journal of Unani and Integrative Medicine. Affiliation Ajmal Khan Tibia College, MU Aligarh, Department of Ilaj with Tadbir. Methodology study design open randomized comparative clinical trial, sample size 40, 20 per group, duration of study March 2022 to May 2023. Test groups in test group taken a standard allopathic drugs methotrexate and hydrochloroquine nuskae munjis for 21st day day oral decoction